So the new one's going to be, 10, 30, 50, 70, 100. Now, the reason they're not going to do a 0, and this is more toward the TBI related thing. So in your six domains, if you have a 0 or a none in each of these 6 domains, you don't have a diagnosis of the condition, because in cognition, none; interpersonal interactions, relationship, none; task completion, life activities, none; navigating environments, none; self-care, none. You have no difficulties, so therefore you have no diagnosis of the condition. So without a diagnosis, there's nothing to give you. So that's why if you have at least one that comes off as mild, that's you need at least the one mild to get a diagnosis, and that gets you the 10% minimum. So,
and I'm showing this part right. I'm showing this part right now. I guess we'll just kind of go in. Do you have that part?
Yeah.
Is that what you're looking at? All right. So I'll throw that on the screen here, and let's just talk through the disability rating, the score, which is the level of impairment 0 through 4, and then the number of affected domains. I know you kind of started that, but I want to kind of timestamp it.
Well, I started at what the definitions were for each one, but yeah, and we probably should go over that. A none would be no difficulties associated with a particular domain. Mild, which is slight difficulties in one or more aspects of the domain that do not interfere with tasks, activities, or relationships.
So one, just to cut you off here, I'm just kind of going from the bottom up. So 0 means 0. 1 in one domain it says 10 minimum rating. What does that mean?
That means you had a 1 in at least. Well, we read about it where you see the 30, where it says 1.
Yeah.
I love to hear 1 in 2 or more domains.
Yeah.
So you have 2 1s to get the 30. The 10% minimum rating.
Okay, so you have 1 is probably a 10. 1. Yeah. Okay. And then as we're going up to, and then 50 kind of has 2. That's similar to the other one, and 70. 50 and 70. So so 50, you have a score of 2 in one domain, and 2 means moderate impairment that occurs 25% or more of the time, or severe impairment that occurs less than 25% of the time. Boy, that could be.
That's 2 days a week.
Right.
If you're looking at 25% of the time based off a 7-day week, that's, you've got moderate impairment 2 days a week.
Now, is this something that's good that you bring that up? Is this something that is it only looked at weekly, or could I be good for 2 weeks and have no problems, in the last 2 weeks I'm just totally shit like the whole way through?
And defined, generally speaking, we kind of looked at it over a period of a month.
Okay, so yeah, that's good.
So
my scenario would be captured, and the one you laid out would also be captured.
Yeah, 25% of the time is a week. Over the course of a month, you might have a week's worth of problems over the course of a month. If you wanted to break that down, it could be, 2 times a week. That's 8 times a month. That's, that's 25% of the time.
Now, when just kind of hopping over to something else, chronic fatigue syndrome, that is measured by the year. So the 60% rating is 6 weeks of incapacitation over the period of a year, which I definitely have that. So like in that one, that's measured by the year. Is that so? And I guess that's what makes this difficult. It's subjective. We don't know when our good days or bad days are going to be until we are in the good or bad day. So there's some flexibility here. Having a doctor write this stuff down on DBQ is the way you land this.
Until we see this on, in the rating schedule, and it's actually, yes, this is these are what's going to be in there, but until it's, the final version is released in the rating schedule, we're not going to know these specific things, until the M21 is updated. to say, okay, like for chronic fatigue syndrome, 6 weeks over a year. Well, for mental health, it might be, over the course of a month. Migraine headaches are another one, which has the time component, X amount of prostrating attacks over, a certain amount of time, for migraine. So until the final process is published, we're not going to know what sort of timetable is put on it. But I could just, say a lot of times we were looking at it, on a monthly basis,
And
incidents per month.
this is another good point. What we're looking at is whoever wrote this, Congressy kind of people, this still needs to get over to the VA and then retranslated. So it's definitely not going to be the same. Right?
Yeah. Well, it was posted by the Department of Veterans. I mean, the VA is the one who posted it, so I mean, they're the ones who did it. But I mean, until the final action is put on paper and into the rating schedule, to where okay, now it's in black and white. Yes, these
Where
are
the
all
CFR is updated, you mean? And
correct.
the M21-1 is the adjudication manual, which is basically the policies and procedures for VA raters to use. They're not for us. It's good for it's good for us to know them. It's what VA raters are supposed to use, but the law overrides everything. The CFR overrides what raters aren't supposed to do. I mean, there are policies and guidelines, but they're not the law.
Correct.
All right. So did we? Let's keep going on that.
Okay,
So
so
we're
now
at 50.
right. So you have to have a 2, which is a moderate in at least one domain. There's 2 ways to get a 70%. You either get a moderate in 2 of the domains, or you can get a severe impairment in one of the domains. And then for the 100%, you either need severe impairment in 2 of the domains, or a total impairment in one of the domains. And a total impairment that occurs 25% or more of the time. Let's just go to, I don't know, you never shower.
Hallucinations.
Well, yeah, but I mean, but if you're just looking at just, you do a shitty job in taking care of yourself. You don't shower, you don't dress appropriately. If you get a total on that just for self-care alone, and you get a 4, or even if you get a 3, that's an automatic 70. A single 3 will get you a 70, right?
Right.
No, yeah, a 3 in self-care.
In one domain, yeah.
Yeah. So, and that's 25% of the time. So, if you don't shower for 2 weeks a month, well, that'd actually be 50% of the time. But if you don't shower for a week at a time, you take 1 shower a week. I mean, you can see how
So
somebody.
let's just break this down for Combat Craig for Dummies style, because I'm bad at math. So 25% of the time, you were saying that's 2 days a week?
2 days a week, or if let's just do it on a monthly basis, because then 25% of the time is a week.
Week. Okay. So yeah, that's a better, easier way for me to wrap my head around it. So 50% of the time is 2 weeks.
Yeah.
75% of the time is 3 weeks, and then 100% is all month long. So
Yes.
that's one way to do it. And since there's 7 days in a week, the breakup's a little different. So it could be 2 or 3. And then
Right.
50% of the time is 3 or 4. And that's kind of why some of these are staggered up a little bit. And then also when you get your decision letter, all of the time, there'll be an explanation in there saying we gave you a 50% rating for mental health, and it'll explain we could have given you a 70, and we also could have gone down and given you a 30. That's pretty standard across the board, right? That language, we could have gone, if it applies, and it does with mental health.
Yes, yeah, and I would say looking at these domains, these 6 domains, the easiest one to get a high score on would be, and I'm not telling you it's the bullshit. You got to be honest with yourself. But the easiest one to get a higher score would be self-care, and that's kind of, like I said, you don't shower. you wear shitty ass clothing, whatever you smell, you don't brush your teeth. I mean, it would be pretty easy to pop a decent score on that. Navigating environments. All too well about this one, Combat Craig, as far as leaving the home. Not wanting to be.
Let me interrupt you because this is important. So this is what I'm talking about. The self-care part is just a no-go for me. I'm the opposite. I want too many showers and smelling too good and looking too whatever. So it just doesn't fit for me. So it's not something I'm going to go after. I don't need to do it. It's just not one of my symptom things. But the fact that you said, all too well about that, this is one that affects me. So I just wanted to hop in and point that out. The things that affect you, those are the things you want to lean in and explore. If they don't try to fit it. Don't try to fit them on you. It's not going to fit. And it's probably lying.
Right. But like I said, in each of these six, obviously I like the way they break it down as far as the categories go, except those are the ones that make sense. But you're going to
the mild, moderate, severe.
No, the cognition, the domains. I like the way they break down the domains as far as these are domains that make sense. Cognition, interpersonal interactions and relationships, task completion,
life activities, navigating environments. Yeah.
So, I like the way that's broken down. Because
what? That actually does. That does make more sense because right now it's social and occupational impairment. The way the verbiage is in the law, this is the part that's going to actually get the update. And yeah, this makes more sense to me as well. Navigating environments is a better way to understand the whole hypervigilance and all the bullshit that goes along with that and the road rage and like everything on that list affects me for sure. Navigating environments, I'm terrible.
So you probably you more than likely would probably get a 3 in that category, which would get you a 70%.
Right. Yep. Totally. Yeah, I would definitely get 3, probably more. There would be an argument for 100% rating for me, but 70 is fair. I'm also 100% PNT. I'm already there. I don't need to make more arguments. And I'm not going to make the SMCS argument either until my rating's protected for 20 years. Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/nexus letters. Click on that link, fill out the form, boom, you're done.